With Lafiya, we get family planning to those who need it and want it, no matter where they live. Let me start by telling you a story. I met Fatima when I was 18, and she's put me on the path to start Lafiya. Fatima is a 28-year-old living in rural Nigeria. She just gave birth to her seventh child. She's exhausted from giving birth. She's also terrified of enduring another pregnancy and delivery. Fatima's last birth nearly killed her, leaving her bleeding and without any nearby medical support. I met her just after she had her third child, actually. She told me she just wanted to take a break from the pregnancies. She had already convinced her husband to try family planning, got money from him to take the motorcycle for an hour to get to the clinic. Yet once she arrived, there were no trained providers, and the facility was out of stock of all contraceptive methods for the past 4 months. The most effective family planning solutions are not reaching the women they were designed for. Indeed, 1 in 4 women in Africa wants to use contraception, but cannot access it. That's 70 million women without a choice. Access to family planning is often a matter of life or death. In Nigeria, women die from giving birth. Every third maternal death in the world happens in this country. This is not a statistic. This is a crisis.
But there's a solution to this crisis. This is Sayana. Sayana is a self-injectable that lasts for 3 months, costs just 85 cents per dose, is discreet to use, and was designed specifically for low-resource settings, exactly like the ones in rural Nigeria. Although it was introduced over 10 years ago, it still hasn't reached the women that it was designed for. Why not? Well, there are 3 reasons. The first one is Sayana doesn't have an effective supply chain to reach the last mile. And secondly, when it gets to facilities, there are no trained health providers with an adequate level of knowledge about family planning. And thirdly, deep in rural communities, women do not know what method of family planning is right for them and their needs.
But don't worry, we got it. We built an end-to-end system that gets Sayana to women who want and need it, with the right product, the right people, and the right approach. So, step 1, the right product. We import Sayana directly from Pfizer. Currently, it's only manufactured in the world. Get it first into Nigeria and then into rural and last mile communities. We provided by step 2, the right people. We train and supervise existing community health workers to become Lafiya sisters. They become trusted providers who deliver family planning care with empathy and discretion. Since Lafiya sisters live and work in these communities, they know how to reach the women who need us most because they have, step 3, the right approach. Using our mobile app, Lafiya sisters counsel women in family planning to see which method is right for them. They also provide free Sayana pairs to any woman who wants it, ensuring that everyone receives high-quality care.
So how's that working out for us? Let's look at reach, impact, and cost. 400,000 women in communities with little to no access to healthcare have already chosen Sayana, and almost half of them are using contraceptives for the very first time in their lives. This reach translates into real impact. In Fatima's community, contraceptive use was just 2% when we started, and now, less than a year later, it has reached 56%. Why does that matter? Because there's very rigorous evidence that family planning use can cut maternal deaths by 44%. And we do all of this for less than $5 per year of contraceptive coverage in programmatic cost, half the cost of traditional programs, even though we only work in the most rural and hard-to-reach communities.
And that's just the beginning. We're now partnering with the government to integrate the Lafiya model into Nigeria's national healthcare system. Not only is government already taking steps to become the doer at scale by leading our trainings and providing supervision to Lafiya sisters, but they're also at the inflection point of becoming the payer at scale. We have recently signed our first co-sharing agreement with the state government to see our impact delivered at scale. The dream we build towards is one where every woman has access to the tools she needs to choose her own future on her own terms and in her own time.
Do you want to join our mission of bringing family planning across the world? We are hiring for an operations manager, and we're looking to expand our advisory board with relevant experts. If you know anybody who would be a good fit, please reach out to us.